Dr. Zandra Petway, and you're watching Dr. Petway and Friends. And today, my very special friend is Dr. David Martin. Hello, Dr. Martin. How are you today?
Hello, Dr. Petway.
I'm so glad to have you with us today. Dr. Martin is a plastic surgeon, and we have all kinds of questions for him about Botox and liposuction and everything. So it's going to be an interesting show.
Great. Thanks for having me.
Thank you so much. So tell us about yourself.
Well, as you said, I'm a plastic and reconstructive surgeon and practice in the Nashville area.
Okay.
I've been doing that since about 1995, and I still think plastic surgery is one of the most amazing and wonderful specialties in all of medicine.
Yeah. Great. So tell us about some of the different types of patients that you see in your office.
Well, plastic surgeons take care of all kinds of different things. We take care of little children that are born with different abnormalities when they're born, do cosmetic surgery. We help people that have been injured in accidents and have sometimes rather awful wounds. We help people that have had tumors or other injuries, and do some hand surgery too, which sometimes surprises people.
Okay, well that sounds interesting.
It is.
Do you do anything like for the cosmetic surgery? Do you do facelifts?
We do lots of cosmetic surgery, and you know, we live in a world where everybody wants to feel their best.
Everybody wants to be beautiful.
That's right, and you know, like some of us who are getting middle-aged, wake up one day and look in the mirror and go, wow, time to do something.
Yeah.
And so we try very hard to help folks address things that are of concern to them.
Okay.
Among the most common things we do, you mentioned Botox. Surgery-wise, do a lot of breast augmentation surgery and breast lifts, a lot of facial surgery like eyelid lifts and things like that. And tummy tucks or abdominoplasty is also are a big thing too.
Well, what qualifies a person for like a facelift?
That's a great question.
Is that just a personal preference or what? You
know, it's really important to see a physician that is going to talk to you about what your goals are, what the concerns that you have are, and listens well, and then offers you what the ranges of options are. And there's so many new and interesting things that are coming out. But basically, facelift surgery is something that's done to correct loose and sagging skin, oftentimes across the neck area and lower face, and some of the sagging that people get that they see that they're beginning to look like their parents or grandparents brings them into the office. Okay.
So when you hear people say like eyelid lifts and chin lifts, are those all facelifts, or is a facelift implant, is it concentrated for one particular area of the face, or is it the whole face?
That's a great question, and for the average person on the street, it can be really overwhelming because you hear about all these different types of noonday lifts and office lifts and Friday afternoon lifts. And unfortunately, there is a fair amount of gimmickry out there. And so I would encourage folks to, you know, see a board-certified plastic surgeon who is experienced in this area. Make sure you know who the doctor is that's going to be taking care of you. But in general, we do eyelid lifts to improve the excess skin on our upper eyelids and remove puffiness on the lower eyelids. We do some brow lifts, which help us with lines and wrinkles in our brow. And then, although there are several different ways of doing it, facelift surgery is really to tighten the area across the lower part of the face and across the neck area.
Okay, alrighty. What about when people get like what they call bags under their eyes? What do you do? Is that a facelift?
It's a very common concern. Some of that runs in families, and people they look at family photos and begin to realize that you know, their dad or their mom had some of those same bags. And so while there are some things we can do like chemical peels and other things for more superficial problems, when you begin to get bags and puffiness and people are telling you to go on vacation when you just got back from vacation, that's a time to maybe think about an eyelid lift. And so a lower eyelid lift or blepharoplasty is used to remove some of that puffiness from the lower eyelids and some of the loose skin that's there.
Okay. Is that a complicated procedure, or is it an office procedure? Do you have to spend the night in the hospital?
I always say it depends if you're the one doing it or the one having it. If you're the one having the procedure, it's always complicated. But eyelid surgery is a really, I had a professor once that said it's the best bang for the buck in cosmetic surgery because, you know, they say the eyes are the window to the soul. And so these procedures can be done oftentimes with a local anesthetic with maybe some sedation. The procedures usually take about an hour to do. Now, admittedly, people get a little puffy and swollen afterwards, but the area heals very well and very predictably, and the complication rate is low and the satisfaction rate is high. So it's a pretty neat thing to do.
Okay. Is there anything you can do before surgery to try to reduce puffiness around your eyes?
Yes. You know, interestingly, especially in this part of the country, a lot of people suffer with allergies and other problems. We have a lot of pollen, as everybody knows, in Middle Tennessee, and taking care of those things, and even simple things like taking care of yourself by by not smoking, getting restful sleep, trying to reduce stress if possible. Those things keep you from looking so horrible as well.
Okay.
But when you get excess skin and fat in that area, then surgery is the thing to do to really correct it.
Okay. What about when people get like chin lifts? Is there anything you can do before to getting a chin lift, like some type of exercise or something at home?
I hate to say, but I'm a bit of a skeptic. And when you see something that reports that it's magically going to make all of that loose skin or tighten those areas up with little effort, most of the time that's not going to do much.
Okay.
Most of the time when people have loose skin below the chin area, a facelift's usually what's required. Sometimes we can do some liposuction there. There are people that have a little bit of extra fat. They don't like the little goose egg under their chin, and that can be addressed just with liposuction. But if there's loose skin, it usually requires a facelift. People do call it a chin lift or a neck lift, but it's usually we call it a facelift.
Okay. And what about we see on TV something called lifestyle lift? Do you do that, or is that a facelift? What is that?
You know, I have to be a little cautious about talking about a proprietary technique. One of the concerns that we have is any advertisements that show patients that are made up afterwards with their hair made up and makeup and smiling when they aren't made up or aren't smiling or look like they just got out from an all-night party. I always tell people to be cautious when they're looking at before and after photos that are not taken under the same lighting and the same facial appearance. Because what we want to do is compare how does that person look in what's called repose. They're just sitting there, and if someone has been to glamour shots and they're made up, of course they're going to look better. And there are several types of these procedures that can be misleading. I'm not necessarily saying that would be the case with lifestyle lift, but it's important to know who's going to do your procedure, find a board-certified plastic surgeon and someone that is experienced in doing that.
Okay. All right, I have another question. You know, sometimes when you see people like movie stars in Hollywood, they get these facelifts and they look great, and then years later they look horrible. What can you do to prevent that?
Well, I think most conscientious plastic surgeons, and we're lucky because in the Nashville area, most of the plastic surgeons do a very fine job and are very conscientious, but there are some outliers elsewhere in the country that do procedures that I think most of us would be shocked to do and wouldn't do. Patients that haven't been told that maybe it's not a good idea to do yet another procedure. So you really want a surgeon that's going to be honest enough with you to tell you whether it's going to help and tell you when it's time to quit. And that is not always a thing that the person wants to hear, but if you're under the care of a good physician, instead of just taking your money and doing another procedure on you that you may not need or may not help, they'll tell you the truth about whether it's how it's going to really turn out for them. Okay,
well that's good. I think you did that same thing for me when I asked you for, what did I ask you for? The liposuction at my ankles, because my son told me I had cankles.
Which is not a very nice thing for him to say. What I would say about you, Dr. Petway, is just tell everybody I'm your doctor, even if I haven't done anything for you, because I think you look great.
Thank you so much. I appreciate that.
You know, one of the other things we do a lot of is breast augmentation surgery or things like that. And you probably know a few years ago they began to allow silicone gel implants to come onto the market again. For years we did what we call saline implants or water-filled implants. And now we have both the saline and silicone implants to use, and it really has made it very nice, convenient, and easy for ladies who were blessed without too much endowment in that area to do something about that. That's an outpatient procedure under anesthesia. It takes about an hour to do, so that's sort of one of the big things we do a lot of.
Okay, well that sounds good. What was the problem with the original silicone implants?
You know, it's a great question. Breast implants are a man-made medical device, and anything that man has made can deteriorate. And so if you have an artificial hip or an artificial knee or a pacemaker, all of those devices can fail, and breast implants can fail. Now the problem was that people were concerned that having breast implants might be making women sick and giving them conditions like lupus or other things where they would become ill or even cause cancer. And so people were terrified that that had been a cause of us harming patients. Now that they have sort of looked at it in exhaustive detail, probably that wasn't the case. They probably didn't make people sick. It doesn't mean that they can't fail, but it doesn't make women sick. And so the FDA allowed silicone implants to be reimplanted, and they're monitored. It's all very thoroughly studied and researched now. And of course, your doctor would go over that with you when you came in to talk about it.
Okay. Did they change the implants at all? Or
well, they're always changing them. They're always working on making implants that'll be more durable and last longer in the difficult environment inside the human body. And I think they really do a great job. And they have been. I always tell people, you know, you're really not paying that much for the implant. You're paying a lot of money for the research that went in to make sure that it's going to last for you.
Oh, okay. All right. Well, great. Well, what else do you do?
Well, you know, we take care of obviously lots of people that have gotten hurt. You know, before airbags, we took care of a lot of automobile accidents. But we still see, you know, people in Tennessee are very active. They like to go work in the wood shop. They like to get on four-wheelers and do a lot of crazy things. And so, although we hope you don't need it, plastic surgeons are there to put things back together again.
Right.
And heaven forbid if a person gets an automobile accident, they've had a terrible injury to their leg or their arm, or heaven forbid their face, plastic surgeons are often involved in trying to restore those areas for them and help with that. We also do a lot of breast cancer care. You probably know Breast Cancer Awareness Month is coming up.
Right.
And plastic surgeons are among physicians who really have a heart for women and their families who have suffered with breast cancer. It is a devastating and personal disease for women, and you know, when women come to see us, we don't just talk them into a reconstruction, but we try to help them both recover from this this condition and regain their sense of being complete and whole. And if that involves surgery, great. And if it just means healing their soul, we try to help them with healing with that too. And so that's a really important thing that we do.
All right, well, that's great.
Yeah, it's really neat stuff.
And you mentioned you also do the hand with carpal tunnel syndrome, or what do you do for
Yes,
that?
I tend to do a little bit more hand surgery than perhaps some plastic surgeons, but all plastic surgeons are trained in hand surgery. You know, the hand is an area of plastic surgery where appearance is really not what we're all about. We want people to be able to do the things that they need to do and enjoy doing, and so we take care of a variety of things, injuries and people that have been hurt, but also things like carpal tunnel and trigger finger and all arthritis and so forth, so that people can continue to enjoy their day-to-day life and the activities that they enjoy so much.
Oh, great.
Yeah. I was going to say too, we this time of year too, for some reason, people seem to be very interested in how their midsections are looking. So we still do a lot of tummy tucks for folks.
Well, tell us about tummy tucks.
Tummy tucks and liposuction. People often come in and they've had 2 or 3 children. And they say, "Can we have liposuction done?" Most of the time, as a general rule, a person that has, you know, if you've had 2 or 3 children, most ladies will not be able to just have liposuction to get things as smooth as they want, because things have been stretched out and haven't tightened up as much as they might like. And so usually a tummy tuck is done to remove the roll or bulge that ladies have after having children. They've devoted themselves to being moms for a while, and they come in, it's about time to do something for themselves. And so if we can, and if the tone is good, liposuction works out great. It's much easier to go through, but a tummy tuck really helps to restore them back to as close as possible to where they were before those birthdays came along and those children came along.
Is that an office procedure, overnight in the hospital, or what happens?
No, you usually don't stay overnight in the hospital. Liposuction, most of the time, is still done in a accredited surgery center under anesthesia. And I think most good plastic surgeons are putting safety number one. We want people to be in safe places to have procedures done where they'll be comfortable and won't be too stressed out. And you would go under anesthesia for maybe 30 minutes or an hour. We treat those areas of liposuction with just a couple of small cuts. And I tell people we'll remove as much excess fat as we possibly can. When patients have a tummy tuck, that's well, it's a lot more to go through. It's about an hour-and-a-half surgery, and it sort of lays a person up for a little bit. It's a little bit more like having a cesarean section or hysterectomy, where although you go home and we would try to make it as easy as possible for you, most folks are out of work or their normal routine for about a week or 2, and it takes a couple of 3 months before you are really fully back as good as you're going to get afterwards. But it makes a big difference, that's for sure.
Okay, well, great.
Yeah,
so
neat stuff.
I guess they do the tummy tuck to get those swimsuit bodies back.
That's exactly what they're doing. That's what they're doing. I want to tell you a little bit too about, you know, we have a lot of parents that are concerned about their children, and they have kids that have either had scars or had some growth or other condition, and they're trying to decide, is it, you know, maybe their child's ears stick out a little bit too far, and it can be delicate. And what I would encourage parents to do in that situation is listen to their child, because you don't want to be the kind of parent that imposes or draws the child's attention to the condition, but being responsive and just listening to them. And if it becomes important to a child and they begin to talk about it, or especially if they're encountering any teasing, or especially if they're having any withdrawal from their social relationships, you know, I would sort of casually mention to them, you know, perhaps you'd want me to make an appointment for us to go in and talk to one of the plastic surgeons and see what they have to say about it. And when that child comes in, I'm going to do the same thing that I just suggested parents do. I'm going to listen to them and find out how they're doing with things. We try not to impose on these kids the additional stress of thinking that there's something wrong. We also want to be receptive to them. It's hard enough being a teenager these days without having something that's a source of embarrassment, whether it's an asymmetry in a girl's breasts, or as I mentioned, ears that stick out too far. And we want to get to know that child and that family and try to do what we can that's reasonable to help them live a less stressful teenage and adult life.
Yeah. Is there a certain age group?
Well, it sort of depends on what the condition is. Occasionally we'll have parents that come in that feel strongly that we need to do something when the child is not interested or has no concerns about the problem. And I like to let the children be a participant in these decisions. And so if it's not very important to the child, and the child's doing great in school and everything, then we would probably suggest not doing anything to them. After all, they're the ones that are going to go through the procedure. But if it's important to the child and their maturity is suitable, then we might think about doing that. We have a lot of patients where, for example, they have either no breast growth or have two breasts that are enormously different in size. It's very embarrassing for a young woman to be going through that. Also, we treat a lot of patients who have excessively large breasts, and that can be just as embarrassing.
The breast reduction surgery.
That's right. So breast reduction surgery can be considered really, I would say, approximately age 17, 16 or 17 at the earliest. Again, depending on where that child is and how they're doing. Breast reduction surgery is an enormously popular and common procedure that gives ladies and women a lot of relief.
Yeah, some people complain of back pain,
they hurt
shoulder and neck pain from heavy breasts.
Their posture, it affects their posture, and their whole outlook is really dragged down by extra weight. And insurance usually covers that, by the way.
Oh, wow. I thought they didn't cover that. I thought it was considered cosmetic.
Well, insurance companies are always changing what they use as their rules to determine this, but historically they have covered most patients that wear, for example, a double D size, provided that they're not excessively overweight. But for most women, if you're a D even or a double D, they'll usually we can usually persuade them that to cover it, and it provides a lot of relief and a lot of improved self-esteem for people.
Yeah, okay, well, great.
It's pretty neat.
Great. Do you do anything like Botox injections?
Actually, I have a great nurse practitioner, and she helps with that. I would, you know, Tennessee is sorting through who should be permitted to do these types of procedures that are not surgical, and I would encourage people to always find out what are the qualifications of the person that's going to be doing a treatment of any type on me. But I have a nurse practitioner that works very closely with me. She has a world of experience in doing Botox, injectable fillers, and things like that. Most patients know that she does a better job with it than I do. But we're a team, and we work together to make sure that they'll have an easy time. I would say a very popular thing to improve one's appearance without having to have surgery.
Now, how long does it last when you get Botox injections?
It depends. The paralytic effect of Botox and the types of filling materials that we use range from somewhere 3 months or perhaps. Some of the filling materials might last now as long as 6 to 9 months. There is some indication that when you have Botox used on several injections, that the muscles themselves actually begin to weaken, so that they atrophy or weaken, so that you might get a permanent effect from that. With that.
Okay. Tell us, what exactly is Botox?
Actually, Botox is a toxin. That's where it gets the word Botox from. And it is a purified substance, and now heavily regulated in the United States for safety, that is used in small concentrations that paralyzes muscle and keeps it from moving. And so lines and wrinkles that are caused by muscle overstrain, it paralyzes those. So you wouldn't want to inject it into the wrong place, and you wouldn't want to use the wrong dose, but in small quantities it can really help with lines and wrinkles.
Okay. Alrighty. So what else do you see in your office?
Well, we take care of folks that have burn injuries.
Okay.
As I mentioned, we talked about the hand stuff we do. Oftentimes we'll see people that have, I treat a lot of patients that have skin cancer, and these tend to be folks that are a little bit older.
Okay.
I always say they're like our grandparents, the little elderly folks that have lived, many of them worked very hard.
So what do you do for the skin cancer? Do you like surgically remove it or what?
There are a couple ways that it can be treated, but oftentimes the people that come see plastic surgeons have developed these areas on the sun exposed areas, say on their face or on their scalp or on their ears. Many of these folks are fair-skinned people, I guess, like myself, who have worked out in the sun. And you know, these cancers can be treated and cured by just removing them completely, which sounds simple enough, except that when it's on your nose or when it's on your eyelid or if it's on the top of your head, the removal part may make it takes some special expertise to put that area back together so that your eye is protected or so that your scalp will heal properly. And so I always say plastic surgeons have a sort of a range of options, or a bag of tricks, you might say, to help get these areas to heal after the person's been treated. So we are responsible for both the removal of the cancer and for putting things back together again. And that's a very rewarding thing.
Well, great. And don't you also work with brown recluse bites?
Yes, we do, and brown recluse bites are very common in Tennessee, and what they cause is a wound or a sore that can take a really long time to heal, and it often is a very upsetting thing for a person. They may not even know that they've been bitten, but they'll notice a small area. That area will enlarge and develop a crater or a black scab, and that will enlarge almost every day for sometimes as much as 10 days. And so typically the person will have gone to the doctor on the second day or the third day, and the doctor treats them in some way, and the next day it's even bigger, and the next day it's bigger. So it's very upsetting for folks. And oftentimes we don't have to do surgery for that, but it's important to identify what caused this problem. Brown recluse spiders like to be in places in Tennessee, like with linens that have not been used in a while, old couches or things like that. So you'll be careful about fumigating those areas. If you pull your couch out from a place that it's been stored in your house and begin to use it again, it might not be a bad idea to spray that down before you decide to take your nap on it.
I know this one. That sounds good. Okay, what else do you do?
Well, I want to talk a little bit about, if I can, about board certification in plastic surgery. One of the things that really upsets board-certified plastic surgeons is that there is so much cosmetic surgery being done and being advertised by people that have no real training in plastic surgery. Now, there are other doctors in other specialties who have had specialized training, and dermatologists sometimes do a really good job. There are a lot of ear, nose, and throat physicians who have special training. But what really worries us is when there are people who are not trained in a facial surgery or plastic surgery field at all, but decide that for monetary reasons that they are going to advertise that they do plastic surgery. There are also places that you'll sometimes see advertised types of liposuction or other forms of treatment where you have physicians with no surgical experience or in these areas that are doing procedures that they're not really trained to do. Now, again, we're very fortunate because in this area, most of our doctors are really well qualified, but it's so important that people ask, what is your training in? If you are board certified, who board certified you, because you want to hear them say, I'm board certified by the American Board of Plastic Surgery. Because what can happen is you could be board certified in OBGYN and decide to start doing plastic surgery, and so they'll tell people, yes, I'm board certified and I do plastic surgery, but they're not board certified in plastic surgery. And again, many of those people may do a great job, but I think that the normal person ought to at least know ahead of time why they might be getting a special bargain rate on a treatment that they're having done. And especially you want to know if things don't turn out perfectly, is this person going to be able to help, or can they do it safely for me, and are they going to be able to take care of me if something doesn't go just the way we want it to? And finding out those sorts of things after a problem has happened is really, really tough. And unfortunately, we see patients that have had some things happen to them because they noticed an advertisement of some sort and followed along with that, and then suffered as a result of it.
Oh, okay. So tell us where your practice is located.
Well, I actually have 2 offices.
Okay.
I have been practicing in the Murfreesboro area and in Franklin now for many years. I started in 1995,
Okay.
and I have an office on Medical Center Parkway in Murfreesboro, which is right across from the new hospital.
Okay.
And then I like to say that I have the best office in Williamson County. It's on the top floor, a corner office at a building called the Williamson Tower, which is a physician building adjacent to Williamson Medical Center in Franklin. And so that sort of helps us with the range of folks, that makes it easy on the range of people that come to see us. And I think people enjoy coming to see us. It's a very nice place, pleasant. We have wonderful staff too. They're friendly, and you'll have a great time if you come see us.
Well, great. Well, we'll definitely put your name and address across the bottom of the screen, and your telephone number, and if anybody's looking for a plastic surgeon, I'm sure they'll look you up.
Know where to come, won't they?
Exactly. Well, thank you so much for coming. Anything else you want to share with us today?
No, thank you so much for being so gracious and having me.
Okay, thank you so much. Have a great day.
Thank you.
Okay, bye-bye.